Good morning, Ice Crowd. I am Zach Morgan. I'm lead faculty with the spine division, so I teach both cervical and lumbar spine division. Um, the rest of our courses are canceled for the remainder of this year, but we've got a lot set up for 2021, so you should be able to catch us on the road anytime you want. In 2021, we'll be all across the country, either myself, Jeff, or Jordan, or Justin teaching the total spine. Any of us should be there. So take a look at our live courses for 2021. Couple things to bring to your attention before we dive into the content this morning. The sampler. So the sampler will be here in Hendersonville, Tennessee, which is where myself and my wife Alexis Morgan own Onward Tennessee. We will be at CrossFit Hendersonville, which is our home gym. And if any of you all do CrossFit, this is an awesome gym. So it's a really, really big space. They were able to build their space out sort of to exactly what they wanted. Really, really cool space. We'll have loads and loads of barbells, loads and loads of tables to practice manual therapy. All sorts of space in there. It's going to be great in the spring, so that's coming up in March, so keep your eyes peeled for that. The last thing I want to bring to your attention before we dive into the content is all of our online courses are starting in January. So literally everything we offer will start in January. So if you're interested in any of those, make sure you check them out on ptonice.com. That's your home for all of our courses. So if you're interested in Sampler, you're interested in any of these online courses, or if you want to catch any of us in the spine division on the road, that's going to be where you want to jump in and find where we're going to be close to you. So if any of you haven't been to Nashville, we would love to see you out there at the Sampler. So it'll be a real big hoot. I think we're going to even get a big smoker and cook barbecue at the end of day one. So it'll be a big riot. So I wanted to talk to you all this morning a little bit about preoperative management, which, early in my career, whether it was a client or a patient that I was dealing with, a friend, a family member, a lot of times it was somebody that I worked out with at a gym. People would end up making the decision to go a surgical route for some sort of musculoskeletal painful condition, right? And obviously, if you all have followed the ICE crowd, you know that sort of, we definitely want to avoid surgery, unnecessary surgery at all costs. There are necessary surgeries out there, but if we can rehabilitate something, that's definitely our focus. But I guess early in my career, I felt so strongly about that when people would decide to go the surgical route, I would have a hard time either forgiving myself if it was a client, like thinking that I had not, I would just constantly think I'd done something wrong. I would feel like, ooh, I dropped the ball here. That's why they're winding up going to the table and ending up with a surgery. So I would beat myself up. If I wasn't beating myself up, a lot of times I would inadvertently shatter the patient's expectations of surgery. I would do a lot of patient education about, hey, did you know with rotator cuff tears, often even with a full one, you can rehabilitate it. And surgery sometimes is tricky. And so I would do things that shifted their expectations to a negative spot, not because I didn't want the patient to do well, but just I wanted them to be informed with the knowledge I had, the knowledge that maybe you can rehabilitate this. And then the last really unhelpful thing that I would do early in my career is I think I would create a little bit of a division between myself and that client, or myself and that friend, myself and that gym member, where they felt like they had let me down. And I think those were all really big mistakes. Messing with their expectations in a negative way, making them feel like there was some sort of barrier between us on a relationship. And I think lastly, like I would let these situations really affect my job satisfaction. So, when patients went on to have surgery, it would affect my mindset in the clinic for the next few patients. It would really get in the way of a lot of progress. And I think as I've spent more time working with patients that have gone on to have surgery, I've realized a lot of those things were very unhelpful, very, very unhelpful. So I guess I want to talk to you all about how I handle this now, because this isn't necessarily a popular topic. We like to spend time talking about how we saved people from surgery, but what about the ones that actually do go on? Like, how do we aggressively manage those folks? We talk a lot about how, you need to aggressively rehabilitate people, right? You need to use real legitimate load so that there is an adaptive stimulus to their muscular system that helps them rehabilitate. But we don't talk about aggressive preoperative management. I think for me early on, if they decided to go the surgical route, often it was followed by like discharge, which is kind of crazy when I think about it now. It was, hey, well, yeah, good luck. Let me know when the surgery is over. John, I look forward to working with you once it's fixed, right? That's a crazy mindset now that I'm handling it differently, and it's one that I certainly don't suggest. So let's unpack how an aggressive pre-op plan would look. The decision is made. So I think the first point I want to make is that once someone has scheduled and decided to be going forward with surgery, their mind is made up. Now, if they ask you for your opinion and you feel like it's a good time to kind of shift some expectations and maybe save them from surgery, you've got to feel that out. But I think if they have fully made up their mind, it's time for us to start planting those positive thought viruses about, hey, Cindy, this is great. I'm so glad you're going to get your shoulder fixed because the truth is, rotator cuff surgery is a bit tough, but in the early stages, but we can always get you back to whatever you want to do. So the great thing is that's going to be fixed soon, and we'll be right back in the gym doing all the things you love. So I think that is thing one. We don't want to make the client feel like they've failed or anything like that. So we want to put that positive expectation out there. But let's talk about some of the things that we do preoperatively. And a few of you, if you want, you could probably bust my chops a little bit about, hey, this isn't in a meta-analysis. You don't necessarily have proof that all these things work. And I'll just tell you, it's firsthand experience that tells me that a lot of these things work. And definitely a lot of it is firsthand experience that's in a fitness facility. So not necessarily in a clinic, but actually working with clients. So when I was in undergrad, I spent a lot of time coaching CrossFit classes at CrossFit Murfreesboro. So we would see a lot of clients that did wind up to go have surgery. At this time, I wasn't even a PT, so there wasn't much I felt I could do about it. But there were a lot of things I think that really helped those clients get back to the gym sooner and have a better surgical outcome. So let's unpack that a little bit. All right. So first things first, you have to have a conversation with these folks about pain. So again, this can be a really deep dive into like pain neuroscience education, which, I think is a good idea, and it probably should be done in a lot of folks that have had persistent symptoms in a joint or in an area, and they're going on to have an operation. If you all aren't familiar with Adrian Lowe, he's certainly one of the leaders in this. His dissertation was on preoperative neuroscience education, pain neuroscience education, in folks that were going on to have lumbar surgery. And so they taught them sort of about the alarm system and central sensitization and how pain works prior to them having lumbar spine surgery. Now, here's the thing. That didn't really change the outcomes that strongly as far as pain or even disability on the disability surveys they measured. But what it did change dramatically was these folks used the medical system much less after their surgery, which if any of you have worked with folks that have had lumbar spine surgery, what do we often hear, right? They still end up with pain afterwards, which makes some sense because some of their pain is certainly centrally driven, right? And so they go on to continue having pain. At 6 months, they go back to the doctor. A lot of times the doctor says, hey, let's give it a year, right? They often say, let's give it a year. So then they go back at a year, right? What does the doc say? Let's grab another MRI. What does that MRI often say? It often says, ooh, look at the level above, look at the level below. All of those things are definitely very present on the MRI after a year of surgery. And so what happens? That person goes on to have their second surgery, perhaps even their third. A lot of times this ends up sort of being a thing that people struggle with chronically. Best way to have your second back surgery is to go ahead and grab that first one, right? This is definitely the case. So I think preoperatively having a conversation surrounding central sensitization, how pain works, I think it's a good idea. In Adrian's study, it really seemed to ease the minds and change the satisfaction in surgery with the clients that did go on to have surgery. So take a look at that one. I think that's a really good idea for you to get after. But I think the better conversation to have about pain in a lot of like truly mechanical cases where they are going on to have surgery is the conversation surrounding irritability. So day one, you should have understood their irritability. And I think at this point, when gears are shifting towards surgery, this is, again, where I would maybe discharge people early in my career. I think now I have a conversation about like, hey, Mike, I know we're going to have shoulder surgery in January once your deductible resets. That's a given. I guess my thought is, now how much pain are you willing to tolerate to get your shoulder in the best condition you can? And if you have a pretty good a pretty good understanding of how their pain behaves, and you can aggressively load that patient, maybe if it's shoulder, which I've been talking about, maybe it's all with arm at the side, and it's just a lot of conditioning work with a band, but they're working their deltoid really, really hard. They're working their rotator cuff as hard as they can, all with their arm at their side, so they're not getting in this overhead position that really gums them up, but they are really getting a lot of blood in their shoulder, really working as much as they can to improve that tissue health deep in their shoulder. So I think to sell that plan of care, you have to sort of understand where's the patient willing to go, where's the client willing to go as far as pain. I know for myself, if I knew I was going to have surgery and there was something I could do on the front end that would dramatically change the outcome, I wouldn't really care if it hurt. As long as it's not a 9 or a 10 and you're disabled after use, if it's just a 6 and I can just hammer that really hard, that's fine with me personally. So I think if you have that conversation and sort of understand where that client's coming from, and they're okay tolerating a little bit more pain than maybe traditional rehab, I think you should get after that loading fairly aggressively. So a bit more aggressively than I think we often do when we're trying to rehab, because we're trying to avoid the pain. Well, at this point, they know they're going to have surgery anyway. So, as long as you're not leaving this person unable to use their arm for a few days after a loading session, I think we need to get after it. So that's thing number one for sure. I would say thing number two is a conversation about lifestyle. We can't really get away from this in any of our courses, and it's because everything is pointing this way when it comes to outcome data, right? I mean, if you don't believe me about like post-op outcome data and like lifestyle, take a look at some of the things that create difficulty with post-operative outcome, right? They're the same cast of characters that we see creating difficulty with all sorts of problems, and they're the things that have a lot of systemic inflammation involved, right? Diabetes, cardiovascular disease, difficulty sleeping. All of those types of things often create a bit of difficulty with the healing process, whether that's because there's so much inflammation on board, or, it's just not a great environment. Maybe the vascularity is not as good to the tissue. All of these things create difficulties when it comes to healing. With an operation, we know we're going to have to heal, right? There's controlled tissue damage, the surgery that is patching up the broken tissues to ensure that the person regains function. When we know we're going to have a healing cascade coming our way like that, we want to front load as much good stuff as we can. So, I think this starts with a conversation about sugar. A lot of us are getting more comfortable speaking about diet. I think the APTA certainly wants us speaking about diet, healthy diet with folks. I think the number one driver of systemic inflammation seems to be sugar. Without a doubt, we want to get their sugar as close to zero as possible. So I really honestly tell people, if this was my client, I would say, Sharon, if it was me, and I'm not going to lie to you, I'd probably cut every bit of refined sugar out of my diet. That being said, if you're not ready to do that, let's pick a number as far as grams of sugar that you think you can reduce to. And often people don't realize they're eating a lot of sugar until you unpack it in that subjective exam. So that's an important thing to do. So you want to make sure you understand how many grams of sugar Sharon's eating before you start asking her to drop it down. Because a lot of times people don't recognize how much refined sugar they're getting in their diet. So that's thing number one, right? We got to get after diet. There's a lot of other things you can do. They need to be eating protein. They need to eat plenty of veggies. All of those things that are anti-inflammatory diet type things, they can certainly work with a nutritionist at this stage if they have the funds and the wherewithal to do that. But I think it's important that on the diet side, we set the body up to heal as well as possible. This is something we never hesitated to do while we were in the CrossFit gym, but I think I see it a lot of clinicians who really hesitate to get after diet with their clients. Thing number two, without a doubt, is sleep. So we put out a graphic on social media a few weeks back. Scroll back through our Instagram feed or our Facebook feed and find that. But we put out a graphic that kind of covered the sleep hygiene tips that Katie Sanxicon covered in her article that was Sleep Promotion for Physical Therapists. So educating them about sleep hygiene, even if they are sleeping well, they can still work on a few of those hygiene tips just to make sure that they're getting really good deep sleep. Again, that's really good for healing. The parasympathetic response there is strong, will help folks heal up post-operatively, but also really help calm their nervous system. All really, really good things. The last thing that you want to make sure you're hitting with lifestyle is stress. So it's always, nutrition, sleep, and stress. With stress, I think my favorite way these last couple years has certainly been mindfulness. Outside of just what I do with exercise and those types of things to manage stress, mindfulness is huge. I think it's definitely not a buzz or a fad. It's here to stay. So mindfulness is huge. And I think it can help people sort of clarify their understanding of how their shoulder, their neck, their back feels. It can help them sort of calm their nervous system, get into the parasympathetic mode a little sooner. They're going to have to be mindful as they're post-operatively, moving through life. They have to be mindful of, am I actively moving my shoulder? Am I stressing this surgical site? So just, I think drawing people's awareness back to their body with some body scanning, those types of things can be a good thing. Mindfulness is huge. So let's just quickly review the high points of what aggressive preoperative management would look like, and then I'll kind of wrap things up. So without a doubt, I think thing number one is if the patient or the client is scheduled for surgery and that's that, I don't think it's helpful to try to save them from the table, if their mind is 100% made up. This happens all the time, right? And so I think it's important that we become a supporter in this role. If you all have looked at placebo data, it doesn't really matter whether they actually do the surgery sometimes or not. The client gets better. So, they have done some placebo-controlled orthopedic surgery trials where they literally still cut the client open, but not done any surgery, and they still had a really, positive outcome. So I think it's not so important to me that I'm right in this case. Whatever the case, we need as much positivity going into that scenario as possible. So we need to get on their side. And then we've got to address, exercise. So we need them aggressively exercising within the realms of what they can. They need to be doing cardio for sure. Get their heart pumping as hard as possible. If we can condition the joint or the area of the body, we want to condition that as well as we can. So, trying to pay attention to their irritability, making sure we're avoiding aggravating positions, but then hammering that joint area with, whatever exercises they can tolerate at as high a load as they can tolerate. We want to prep the tissues surrounding and maybe even the tissues that are going to be operated on. We want to prep them by adding as much robust tissue to the area as possible. Without a doubt, I think very few of us would argue that it hurts to be strong when it comes to surgery. So I think you want to be as strong as you possibly can. I think that's definitely going to create a lot of ability to bounce back quicker, which is what most people are going to surgery for. And then lastly, you have to have those conversations about lifestyle. It needs to be a conversation about diet, getting their sugar down, getting really good deep sleep, and then lastly, managing their stress. Since I've shifted my thoughts on preoperative management from, go ahead and grab that surgery. I'm not sure if it's going to work, but do the best you can. Since I quit thinking that way to how can I help this client now and unpacking these things, not only has my job satisfaction increased a lot because I feel like I'm actually doing something for people to help them. Not only has that happened, but every client I've seen has had a much more dramatically positive interaction with the medical system and with surgery. So they've done much better. So I would encourage you all to start considering the lifestyle factors in your clients that might be playing a role when they're going on to have surgery and move forward as much as possible. I would love to chat about this. If you all have any questions, definitely fire them into the comments, and we'll have a conversation ongoing throughout the day. When clients have surgery, we have to still be there for them. We can't only be the knight in shining armor that's saving them from the table, right? We have to service our clients and meet them where they're at, do the best job we can to really help them out. So check us out on the road. Again, Ice Sampler will be here at the home base in Hendersonville, CrossFit Hendersonville. You can come by and see Onward Tennessee whenever you're here for Sampler. We'll love to have you. But we're looking forward to that. Check out all the online courses that are starting at the beginning of the year, and looking forward to continuing this conversation as the day goes on.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.